Good evening, Dr. Gould. I am so happy that you responded to my invitation and agreed to talk with me about chiropractic care. And we're going to talk for my website and talk with Doc. And how are you doing tonight?
I am doing very well. Thank you for having me.
Again, thank you so much. And I'd like to introduce you by reviewing few sentences about you, because I think that it really nicely shape who you are, what you are doing, and I'm sure that it also goes along with the spirit of your practice. So you are not only chiropractor, practicing in Rhode Island for 3 decades, but and in addition, having it's important to be advocate for your profession, and you certainly have been advocate for your specialty. You have been a past president of Chiropractic Society of Rhode Island, and you also been independent medical examiner for Rhode Island Worker Compensation Court. And what I like to mention about you, and I think it's so noble that you also are involved in treating VA patients. I think it's so honorable. Anytime we spend any minute of our practice helping veterans, I think it's so important, and it's such a great service, and I thank you for that. And you also represented the chiropractic profession on Medicare Career Advisory Committee for over 10 years. So that's some fantastic resume. And, I like talking with medical professionals because there is such an immediate link. And I think, especially in musculoskeletal medicine, we pretty much can very quickly identify with similar patients that we see and similar difficulties and experiences. But being an educator, I always start with trying to find out the pathway. How do you become a chiropractor?
Sure. So, how did I become a chiropractor? Like my personal story, or how would the general public become a chiropractor? Or both?
Whatever you want to do.
Yes. Well, I know my story. When I was just a teenage boy, unfortunately, my mother was involved in a car accident. She herniated 2 discs in her lower back, and she was in quite a lot of pain. Anytime she was up and weight bearing, the pain would shoot down her leg. She had a very close friend who had a problem with his discs and had some surgeries, and unfortunately the surgeries did not go well for him. So that made her very, very hesitant to have surgery. So she went through a prolonged period of therapy and treatment with medications and various means to try to get relief, and was unsuccessful. So eventually they wheeled a hospital traction bed into my ranch where I grew up, and it couldn't fit down the hall to a bedroom. So they stuck it in the middle of our family living room. And there she was in traction for most of the day, because that was the only way she would get relief from the severe sciatic pain she was having. So I was a teenage boy, and obviously that made quite an impression on me. And she did that for a period of time. Again, she probably needed surgery, but she was afraid to have the surgery. And after, I'd say, months of doing that, she finally got a recommendation to go try chiropractic care. And it wasn't instant success, but it helped her so much, and it left an impression on me that at the time I said, wow, this is really something very interesting. I think that's what I want to do. And I just always kept it in the back of my mind and saying, that's what I was going to do. I was going to go off to chiropractic college eventually. And one thing led to another. When I went to undergrad, I studied, I was a biology major, and I always kept it as, pre-chiropractic. Meeting with my advisors at the time, they didn't even know too much about chiropractic schools. So I would write to the schools, and they'd mail the catalogs, and they'd look in what prerequisite courses I would need and make sure I had the right ones. And when the time came, I applied, and it's accepted. So I went from Rhode Island College out to the National University of Health Sciences, which is located out in Chicago, and studied out there. It's a 10-trimester program. And when I completed that, I came back to my home state and took the licensing exam and started practicing. I started off working as an associate chiropractor with a practice in Providence, Rhode Island. It was called the Providence Health Partnership. And it was actually a multidisciplinary practice. It had 2 massage therapists, it had a clinical psychologist, and 2 chiropractors. So they tried to cover like the soft tissue aspects, the mental health aspect, and the structural aspect of chiropractic. The guy that I was working for, the chiropractor, he happened to be a graduate of Brown University, so he had a lot of connections with health services there at Brown and some of the sports teams and such. So right from the early days of my practice, I got to work with other specialists and go and work as a more or less a team member with health services or the athletic trainers or whatnot, and we'd all share patients back and forth, and so that kind of started things off for me. After 2 years of doing that, I started my own practice out in Smithfield, Rhode Island.
Okay, so when you're telling me about the clinic that you were part of, multidisciplinary approach to musculoskeletal health, what it sounds like you did 3 decades ago, my question to you is, why did we miss so much time? When I think about me starting medicine and everybody tells me, you can't go home unless patient has 0 out of, whatever scale you use on pain, and prescribe narcotics. This is how I did my residency. And it was very punitive if you didn't. And then, I'm getting into fellowship and I start practicing, and, we have opiate epidemics. And for the right reason and understanding of the mechanics of opiates, we went away from pharmacological management of pain into this multidisciplinary approach. And, I want to talk to you about it. How do you feel that there is just more agreement or this team approach right now for you being part of a team and people being open-minded and patients sharing it, and physicians having more open approach to how we treat pain and about the referral also, and the treatment that patients that we recommend to our patients?
Yes, I think through the years it certainly has gotten better that way for multiple reasons. I mean, right now with the problems with opioids and the complications people are having with those, I think a lot of allopathic physicians are looking for alternatives now, where before things were going a little smoother and they were able to stay within their world and not really have to look outside for alternatives. They could prescribe the medication and that took care of it and then just move on. So I think sometimes it takes a crisis or an adverse situation for someone to kind of think outside the box or start looking at other options a little bit. And I think that certainly has helped. The other thing is it's changed a lot through the years. When I was in school, there was actually a lawsuit that took place between a group of chiropractors and the AMA, and the chiropractors won and went all the way to the Supreme Court. And basically it was proven within that case that there was actually the AMA was trying to eliminate the chiropractic profession, actually discouraging their patients to come to us. And so I think once that happened, from that point on, once the case was won in court, I think that kind of opened the doors for the average medical doctor to start working with chiropractors, where I think before that they thought they would get some sort of political fallout or pressure from their peers if they did. So again, that was in the 80s. So I think from that point on, it kind of, the ball started rolling, and things have changed a lot from then. It used to be just very much you had the medical doctor and he was the primary care provider, and then you had the various medical specialties like yours. And now it's very different. There's a lot of mid-level providers out there between the nurse practitioners. I think the osteopathic profession has grown immensely, and particularly in primary care. And with osteopaths, they are very, very much more open to holistic healthcare and certainly manipulation, because they're trained in both in their schooling. So I think that has helped. And as they work side by side with the medical doctors, I think that makes the medical doctors say, okay, maybe I'll listen to this, or maybe that's not such a bad option, and it makes them more
Right.
comfortable, having their patients see a chiropractor or a massage therapist, or working with other licenses and practitioners.
That's very interesting what you mentioned about the osteopathic doctors, because in my programs we have throughout the years a few doctors of osteopathy, and I've worked more recently with two of them. And first of all, they are fantastic, but you're right that sometimes they definitely use manipulation. They use their hands, and I see that they do it throughout the training. So what helps them to be part of this, holistic community, or another word that is being used a lot is integrative healthcare model, is the training. And remember, we were planning to collaborate on possibly, we will come back to that, about you incorporating some of what you're doing, manual therapy, chiropractic care, into rheumatology fellowship, because I truly want to prepare my fellows to be a next century physicians. So they are not lost like we were lost at first days of practicing telehealth. If you ban something or you say no to something for so many years, and when you start, you're going to be shy about it, and we better get ready. And if this pandemic doesn't teach us that, that's really a shame, because we should really see what's on the other side of and that there is a rainbow. And I want to change questions a little bit and ask you, so I'm a rheumatologist, you treat multiple musculoskeletal disorders. How do you see the perfect patient that you can help? Let's say that, I have a patient, and is it usually the chronic back pain? Is it the stiff muscles of the shoulders or of back? Or is it some additional thing that you really quickly can assess or triage? I can really help this person. How can you help me with that?
Yeah, well, typically it is someone with neck pain, back pain. Those are the most common conditions we see. And it's going to be people that have some sort of structural component to that. So if we look a lot at the spine and the pelvis and the structure of the body and how it relates to how the patient's functioning. And we look for either abnormal movement patterns or tight muscles or some sort of change within their muscles or the structure of their spine that turn around and is affecting the way they function, the way their standing time, their walking, their range of motion and such. So that's the avenue we come at it from. So anybody that has that as a component of their condition typically does well with our care. Now, you can come at that problem from a number of different ways. It can be a postural strain. It can be a traumatic injury, a sports injury. It can slowly happen over time as somebody perhaps gains weight and they decondition, and then suddenly the spine now shifts and is no longer weight bearing and moving the way it once did, and that puts abnormal pressure on structures, and they develop an abnormal movement pattern. Or they can have an underlying condition. A lot of our patients and a lot of people in general have osteoarthritis. Osteoarthritis causes stiff joints and abnormal movement patterns, and sometimes can cause irritation to the surrounding nerves or muscles, and that can create issues that we sometimes, you don't cure the osteoarthritis. What you do is you reverse some of the changes that have taken place due to that osteoarthritis. You get rid of the inflammation and the stiffness and the tight muscles, and then therefore the people not only feel better, but now they're moving better and they function better in their daily activity. Some chiropractors do manipulation only, and some, like myself, that went to other schools, do manipulation and physiotherapy. So that would include things like electrical muscle stimulation, ultrasound,
Okay.
kinesiotape, and myofascial release, trigger point therapy, inversion traction, regular traction. So I'm not a physical therapist, but I am licensed to do physiotherapy under my chiropractic degree, which not all chiropractors are therapy.
So going to the beginning of chiropractic care, it dates back to 19th century, where Palmer and then his son really recognized this instability or subluxation in the skeleton. And there's also another concept in chiropractic care, being a mixer or being a straight chiropractor. So which ideology do you follow? Do you have any specific, or how would you
Yeah,
define yourself?
yeah, I would be considered a mixer because I do both manipulation and the modalities and therapeutic exercise instruction. Yes, and some use the term straight mixer. Sometimes they use subluxation based chiropractor versus some of my colleagues, and I even got the law changed in Rhode Island, consider themselves to be chiropractic physicians practicing chiropractic medicine. That's how the Rhode Island law is written right now for us right now,
Wow,
because they wanted to demonstrate that it's not just manipulation only, that
right.
basically a patient comes to us, we take a thorough history, we do a full exam, we find out if they have an underlying condition that needs to be referred out to someone like you. So if in my workup or we can order blood work, we can order diagnostic imaging. And if we find something, let's say I take an x-ray and I see ankylosing spondylitis or, psoriatic arthritis, and then I refer it to you for
Right.
medical management of that. But at the same time, I may continue to work with the patient to help them with the side effects of that condition, the tight muscles or the restricted range of motion, or helping them to get back to full function.
Got it. And you mentioned something that is very interesting, and actually, it was included in the recent guidelines of management of knee osteoarthritis. Is the skilled knee taping being beneficial? And I had a few patients that came to my office, and they were all taped. That's very interesting modality of the treatment, and it seems, I always like the non-invasive. Modalities to treat pain, and osteoarthritis gives people so much pain and limitation of their activity. Do you have any comment on that? How often you do that, and whether you recommend it commonly?
Do KT taping, kinesio taping. It's something that I don't do it on certainly every patient, but certainly at least once a week I'll be applying that to. I find it a lot of times people that are very active like to have that on. I think they feel like it allows them to say they're a competitive weightlifter or something
Okay.
like that, and they have an injury in an area, and the muscle guarding and the pain in the area is stopping them from doing their workouts. By working out the area and then applying the KT tape, they feel like they have more range of motion with less pain, and it allows them to resume their activity sooner. And that's kind
Mhm.
of when I use it with a lot of
Okay.
athletes and following a rehab of an injury. So I'll use it for that too, to allow people an earlier return to activity. It seems to break that pain cycle for them and allow them to
Okay.
be active sooner. I don't know if it's a proprioception thing with it being on the skin.
Mhm.
They have a couple of different theories. I've taken some seminars on it to learn how to apply it and where to apply it, and they're not exactly sure how it works, but they just tell you how to apply it and when to use it,
Okay.
and I have had some good results with it.
Yeah, that's very interesting. So far we touched upon, treating back disorders, muscles, inflammatory disorders, and definitely this collaboration between, what I'm doing and using what modern medicine has to offer, but also, need for some less invasive modalities to treat, whether it's stiffness, whether it's pain. We touched upon treatment of osteoarthritis, applying of the tape. Can you tell me about any patient that you can think of that was very rewarding to you recently that you helped?
Well, there's been a number of cases through the years that I found rewarding, obviously, but the ones I like personally the best are the ones that they kind of come to me last. They've had a problem for a while. They've gone through a long period of taking anti-inflammatories. They may have had a course of physical therapy. And then they come in, and we're able to somehow, some way find something that was missed a little bit. It could be maybe a leg length discrepancy and we add a heel lift. It could be just adding in the manipulation, which maybe wasn't being done at therapy. And all of a sudden they break through and they're able to get the results they were looking for. So cases like that I've had through the years, I certainly get a lot of pleasure out of seeing that result. And then quite frequently, there's people that come in, they have to be in the early treatment assisted into the room because they're in so much pain, they're antalgic, not moving well. And it's very rewarding over the weeks of therapy to watching them improve until they get to the point where they're no longer in pain and then now, walking and functioning at a normal level. So there's a couple of cases like that. And then it hasn't happened too often, but it also it stands out in my memory. There was a case in the past that got referred from a local primary care physician. Person was in a lot of pain, 9 out of 10 pain. Came in, and during my history, there was just a couple of red flags that went off that just didn't seem right. He was having a lot of night pain. When I did the exam, his symptoms weren't really aggravated by my exam. He had pretty good range of motion. And so something just didn't seem right. And I ended up ordering some tests, and unfortunately I found out that, he had metastatic bone cancer. He had prostate cancer 12 years earlier that he failed to mention to both the primary care and myself, but he had been seeing an oncologist, but I just remember because the primary care physician was so appreciative that I took the extra steps and something didn't seem right to order the test so again, working as a team to catch these things early so the person could get the appropriate care and we could refer them out and get them treated with the oncologist again. So that stands out because it's so unique. That doesn't happen too often, and I was kind of happy that I take the time to take a proper history and do the exam to screen out the people that don't belong with me and refer them out to where they belong. I think that's a big part of doing what I do. It'd be very easy just to focus on my particular specialty, let someone come in, just start them on a course of care and not take the extra steps to try to figure out if they truly belong in my practice or not. So those are some cases that stand out.
So that's you're bringing very important point of triaging and a great history. And I spoke with another rheumatologist recently who also has been doing some telehealth, and he said, you go back to the medical school and it tells you that so much what's going to be your hint, what the diagnosis is what patient really tells you. And even with this telehealth, the history is so important. With rheumatology, as you know, there are some concerns about there are certain parts of manipulation that we probably shouldn't advise, and one of them is if patient has ankylosed neck, and because they may have very brittle bones, and they actually because there is loss of connection in between bones, these patients may have a fracture of the spine.
We're actually taught that that's a contraindication for high velocity, low amplitude manipulation. Now, that said, because chiropractors aren't only manipulators, or at least I'm not, sometimes there's other things we can do. Sometimes that's when I would turn to my modalities, maybe do some ultrasound or maybe some light massage, gentle range of motion stretches. But absolutely, I would not thrust on a spine that has ankylosing spondylitis. I would not thrust on a spine that has advanced osteoporosis. I would not treat someone that is going through an active infection of a joint or a problem like that. There's a whole slew of contraindications to, a thrusting type of manipulation. And that's part of our training, to know when to do it and when not to do it.
Absolutely.
So,
absolutely.
You're absolutely right. That wouldn't be an appropriate patient for, high velocity manipulation.
And, and there are limitations to everything and anything that we're doing, such as, not every neck pain and headache will be rheumatological. Sometimes there are maybe red flags and the patient may need to go back to the primary care or the neurologist. And, not every swollen joints will be appropriate to inject. Sometimes, the first best step is to drain this joint, obviously. And so it's so good that, you're keeping these things in mind, and it's supported by science and practice by your education. It's fantastic. And so, finishing up, I have such a nice time with you here today.
Thank you. I enjoyed it also.
And it's late evening. uh, so, I'm thinking about my neck a lot, and we changed from this, nation that goes to work and commutes and spend 45 minutes on average on daily commute, to sitting in front of a computer for 8 hours straight, if not longer. So right around 11 a.m., I start noticing neck pain, neck stiffness, and a really unpleasant feeling in my upper body. So I'm thinking, well, I need to talk to Chris. And I need to ask him, what should we do? So what are the important things from your standpoint that you would recommend to all of us, sitting in front of computers? And it's not going to change anytime soon. So some tips that are helpful for the health of our spines.
Sure. So yeah, so that is happening because so many people are working from home right now. That is something I am seeing quite a bit in the office. So the first thing I advise people is to take the time to set up a workstation at home where you have the proper setup, good ergonomics, a nice chair that you can sit up nice and straight, and something that would support your back, and move the keyboard close enough so that you're not reaching for the keyboard or the mouse. The last thing someone should do is sit on the couch and work for hours during the day, or sit in bed with pillows behind them. It just does not give you the proper support for you to be there for hours on end. And so you do it long enough, and sure enough, you'll develop a postural strain, to the area, which is one of the things we see quite a lot with people these days. With it's not from working at home, it's from their spending hours on their phone, or even teenagers on the video games, hours, hunched over playing those video games. And next thing you know, they wonder why they can't turn their neck. That's the perfect type of problem that we treat, and we can give them advice to avoid it. And the other thing I would recommend is trying to take breaks whenever you can, instead of going hours on end. If you could just somehow schedule in 5 minutes to get away from the computer, walk around, do some gentle range of motion stretches, and roll the shoulders, and just move the area. Or if you can stand part of the day and sit part of the day, so you're changing the pressures, that can help you from developing in the strain as the day goes on. At the end of the day, it's a lot of times when you have the work at home, people don't have the same work-life balance. You end up working for a while, and you go and do something, then you go back and do a few more hours. I kind of advise people to make sure you're keeping that balance. Put your hours in, do your work, but then turn off the computer. Go for a walk, spend some time with your family, do something different, because we all can get caught up, and next thing you know, you're going back to checking your emails at 8 o'clock, or reviewing a case or something. So I advise people to keep a balance there, so that you're not getting overwhelmed and stressing yourself out during these very hectic times, because it's very convenient to work from home, but sometimes that convenience can make it so that you actually work too much.
Yeah. So, I go to the office, but it really, whether you office, it really changed, because, my visits every 15 minutes, I go see patient, and it was constant up and down. And now with the telephonic, it's just really one office, one position. So I'm going to ask you to do a simple stretch with me. Why won't you show me how to stretch? I'm ready.
Okay. So this is a particularly good one for the neck and the upper back. I call it a posture reset. And what we're going to do first is we're going to return the curve to the lumbar spine. So bring the curve into your lumbar spine and sit up nice and straight. And then you're going to squeeze your scapula together, your shoulder blades, and try to stretch in the front as far as you can go, and then let that come back. And then you're going to take your chin, and you're going to let it glide as far as you can back. So you're doing a chin press, and then come back. So what we just did is we took all three of our curves to an extreme. We set it up, we increased the lordosis, we extended our kyphosis and squeezed our shoulder blades together, and then we brought our neck all the way back. And what that does is when you come back to your neutral position, it puts you in a more neutral alignment. So now you're in a nice neutral alignment. And what I like to tell people to do is just reach down and grab the chair they're sitting on, let's say your left arm, and then turn your head a little bit to the right, reach up with the opposite hand now, just about 45 degrees, and then pull that forward so you feel a stretch through your upper trapezius like that. Perfect, just like that. And then bring it back, and then do the same thing with the opposite side. Hold on to the chair so that anchors the shoulder down, turn away from that shoulder, reach up with the opposite hand, and give it a nice gentle stretch for a count of 5, and then back. And if you do that throughout, you're doing a little bit more rotation than I'd like to see. I'd rather see just like a 45-degree angle, and then just pull yourself forward so you feel the stretch coming from your right through your upper trapezius. So the opposite way. So you're going to turn your head to your right, that way, yeah. So you're holding on with this your left arm right now.
Yes.
Yep. So now use your right arm to grab your head and just give it a little pull forward on a 45-degree angle forward like that, so you feel the stretch right through there. So exactly, that looks pretty close. So you should feel that right through your upper trapezius, maybe down into your levator scapula, your rhomboid area, as you can play around with the angle, just so you feel a good stretch through there. So that would be a stretch I would recommend for someone that's spending too many hours doing telemedicine.
And I'm doing my little yoga namaste. Thank you for you.
Yes, those are perfect. Yoga is a perfect thing for people to do. Not only is because of the stretching component, with the breathing component to it. So they take those deep cleansing breaths and they relax, and it can be, we need to do that also.
Absolutely. And I start my day with a little combination of stretches and yoga postures. So thank you so much. This was so much fun and so educational. And I learned a little bit of the stretch that I'm going to continue. I'm going to rewatch this video and see what I did right and wrong, because I'm not sure that I followed your recommendations completely.
It's difficult to give the instructions this way.
Especially the mirror view.
Exactly.
So thank you so much again, and have a nice evening. And I think it's great. Another great message from today evening is the collaboration and open-mindedness and kindness and being ahead of a curve. And I learned it from you. You've been doing something for so long, but we just catching on, Dr. Gould. You did it all along.
Yeah, we almost out of necessity, as being a complementary provider, we had to kind of find our way in, where a more traditional provider, you had everything set up right there for you, so you really didn't have to go looking for it. But it's there if you go looking for it. There are a lot of very capable people that would love to work with you, and I know from your other videos that you found some people that, whether it's with nutrition and certain massage therapists and physical therapy, chiropractor, everybody working together, I think we can better serve the patient's needs if we work as a team.
Yes. So just to stress you out a little bit, I also just had a conversation with financial advisor.
Yes.
That's an interesting angle.
Yeah, that'll put a few knots in your back.
I know, immediately. So thank you so much. And
thank you for having me.
I wouldn't mind inviting you back and talking about some specific disorder or some maybe more education.
I'll certainly be open to that in the future.
All right.